At People Powered 16, health professionals, researchers and those who use support and services in the third sector came together to discuss 4 cross-cutting themes: assets, conditions for change, conversations and lived experience.
Sharing was really the key to it. See things as genuine experiences and feedback that can enrich what we do.
Chair for the discussion was journalist and broadcaster Ruth Wishart, who started proceedings by describing the work of people-powered health and wellbeing.
It's a route map to Scotland's future health provision, and it links the health and the skills of the health and social work professionals with the experience and aspirations of those who use their services and are an important part indeed of helping to design them.
Speaking around the theme From Experience to Action, Lisa Curtis, Programme Director of People Powered Health and Wellbeing, set the tone.
The experience we want to share with you is this: that lived experience, the experience of people, is the energy that can power change. People know best what resources for health they need for themselves and in their communities.
Kath Denham, Director of Strategy, NHS Health Scotland, envisioned creating a fairer, healthier Scotland together.
People power is critical to reducing health inequalities and to progressively realising the right that all of us have to the highest attainable standard of health.
When you invest that bit of time in having conversations with people, listening to them, understanding what really matters to them, it saves so much money down the line.
We were more talking about how you value people's lived experience, and I think we're saying one of the issues for me is the NHS talks about evidence-based services, but they're very limited in what they see as evidence, and they certainly don't see people's experiences as evidence.
Forum Theatre enables communities to make and use drama to uncover and challenge injustice or flaws in a system.
Go out the room and go over to reception, just over there, and just say to them, "Can I speak to Karen?"
Somebody get some oxygen, please. Can we have a drip up here, please?
Active Inquiry worked with Anne McClinton of Healthcare Improvement Scotland and members of the People Powered Health and Wellbeing Reference Group to create a theatre piece to examine health and social care in which the audience was encouraged to interact to illustrate better practice.
So Liam's actually the expert in his mum's own health at this point, and they've missed an opportunity of getting really valuable information from him.
Would you like to come and just show us what that expertise looks like? Thank you very much. Up you come. That'd be amazing. Thank you.
Hearts were lifted by community singing, led by the Maryhill Joyous Choir. Workshops provided the opportunity to dive deeper into very useful approaches. Storytelling empowered people to share lived experience effectively. The discovery of conditions for change was approached through mapping assets. Comedy is a great way to explore and rehearse potentially difficult conversations. Good conversations discussed how to connect and build relationships. Peer researchers shared experiences, describing how you can do it too. The Forum Theatre workshop explored how we interpret situations from a simple snapshot.
It's great to see that within the system there is a place for being positive and person-centred in a genuine way.
To bring the strands together, speakers discussed how do we take this learning forward and create the conditions for change.
I think the Forum Theatre was really good at unpicking what does a good conversation look like, what does it look like when care is delivered that actually suits people, is designed around their needs.
The hard bit is getting from here to where we want to be.
The business of creating the conditions for change, the Alliance was set up and it's been constantly trying to create the conditions and the narrative for change.
How often have partnerships been brought together by organisations who have egos, who have cultures?
Conference was inspired to drive the repowering of Scotland's health and wellbeing by Mike Stevenson.
Right? And he said when people come into a room, I say to them, if you've come to represent your organisation, we don't want you here. If you've come to represent the vision, you're most welcome.